Hey, Dr. Matt here with Plaza Dental. I just wanted to run through some information on dental implants. So, dental implants, they're really the gold standard nowadays for as far as treatment option for replacement of a missing tooth. At the bare bones of what a dental implant really is, it's a man-made titanium tooth root that gets surgically placed after a tooth is extracted, and it serves as an anchor for crowns, bridges, or dentures. The big benefits of dental implants, for one, we can restore your smile and thereby restore your confidence. It can drastically improve your chewing function. Implants are really beneficial in that they preserve the bone of the jaw once they're placed. And then also we can improve the performance of traditional dentures by anchoring those to implants. And implants are a really predictable treatment. The long-term result for 10 years has a 98% success rate. So I just wanted to run through, kind of what the appointments are like if you decide to go through with having a dental implant placed with us. So assuming that the tooth has already been extracted and everything's healed, what we'll do is we'll bring you in for that surgical placement appointment. So we'll numb the site with local anesthetic, and then we'll make a small incision over the gum tissue to access the bone. We'll surgically place that titanium post or screw where that tooth root used to be. And then once it's placed, we'll place what's called a cover screw or a healing abutment into the implant itself, and then we'll suture the gum tissue over the implant. Once that's in, we have to let everything heal for about 4 to 6 months. Basically what needs to happen is the bone needs to fuse with the titanium of that screw so they can become really strong and sturdy to have a crown on top of it. Appointment number 2 is what we call the implant uncovery. So again, this is after that 4 to 6 month period. Sometimes what we need to do is if that gum tissue is completely over the implant, we have to make another small little incision over where the implant is to expose it, and then we'll place a taller special healing cap into the implant. That needs to heal for about 2 to 3 weeks, and then we'll bring you back to take the impression for your final crown. So again, that third appointment, 2 to 3 weeks after the uncovery appointment, what we'll do is we'll remove that healing cap, and then we'll place a special impression post into the implant. We'll take that impression, we'll send the models off to the lab. 3 to 4 weeks later, your crown will be ready. So at appointment 4, that's the crown and abutment delivery. So we have the crown here, and then we have the abutment, and then we have the implant. So that abutment is kind of that in-between area where the crown will actually be cemented onto the abutment. There's a special type of implant crown called a screw retained crown that has a little small access hole. If you have that particular type, we will place a small filling into the crown just to cover up that access hole. So now that you have your implant crown, I just want to discuss, some post-implant crown, care. The great part about dental implants is they can't get tooth decay like natural teeth. That's always awesome. However, bacteria can still cause problems. Bacteria can get underneath the crown itself and get down around the implant. That can lead to bone loss of the implant and implant failure or infection. So the best thing to do, obviously we want you to keep up with your routine 6-month cleaning and checkups. That way we can make sure everything looks good and nothing's going wrong with the implant. Maintaining a really good brushing and flossing routine. And then for all my implant patients, I like to recommend them investing in a water flosser. It's really the best way to kind of keep the area clean around that implant crown, just to make sure that that implant, will stand the test of time.